It was excruciating. She couldn't hardly walk. She couldn't hardly talk. She couldn't hardly breathe through the pain. It was so intense. Okay, so walking into another day in nurse practitioner clinicals, and I'm super excited. We have a very heavy caseload today, which means there'll be tons of things to do, tons of things to learn about, and tons of things to see. So I can't wait to get inside and get started. As per usual, I will share with you guys a recap of the kind of patients that I saw, the new information I learned, and in today's video I will have a free printable linked below, so go ahead and check that out, print it off, and add it to your nursing school binder. And yeah, let's get started. Okay, let's talk about this day. It is late. It is about 7:30 p.m. So I had an 11-hour clinical day, and I'm smiling because it was super exciting. I was able to do a bunch of pelvic and bimanual pelvic exams today, and I was able to go into a surgery at the end of the day, which is what kept us so late, which I'm so grateful that I was able to go in and observe the surgery. So let's talk about pelvic exams first. Having a difficult time being able to actually palpate the ovaries even in the thin patients, which I know is normal. However, it would be really nice to know what I was feeling. So the doctor said practice makes perfect. The more exams you do, the better you'll get at them. And then completing the pap smears is really intriguing to me. So today we had a patient who I inserted the speculum. The doctor her mind was kind of everywhere. We were dealing with a bunch of different patient scenarios at the same time. And so when I put in the speculum, she was getting the swab, and she thought that the patient had a hysterectomy, and we did the whole thing. I did the breast exam, and then we did the bimanual, pap, everything, left the room. And then she said, hold on a second, and then went back, and actually she forgot, and no, the patient did not have a hysterectomy, just the speculum was actually not completely in the right direction, and there was some discharge, postmenopausal discharge, that was actually covering the cervical os. So we actually had to go back in and redo the pap. So I was kind of disappointed in myself. I know I need to give myself grace. I know that I'm just learning, but I'm so intrigued by women's health, and I absolutely cannot say enough kind things about the doctor that I'm with. She's so knowledgeable. She's so helpful. And, she's every single thing that I prayed that she would be in a women's health clinical rotation. So I'm super excited about that. But we did have a patient who had a yeast infection today. And the reason that excites me is just simply because I was able to actually see the yeast inside of the vagina, on the cervix. It was very easily notable what it was. And so the doctor went ahead and sent over the prescription, went ahead and sent a culture just to identify the exact type of yeast that was growing, because there is more than one, which was something new that I learned today. Because I honestly thought that vaginal yeast was vaginal yeast. However, that's not correct. There are different types. So that was interesting. And then I guess lastly, I'll share with you about the surgical experience at the end of the day, which it was super exciting. Don't forget to check the description box below, because I have a free printable of some just FYI, nurse practitioner student FYIs that are really important for you. So go ahead and check out that box, and then subscribe to the channel if you haven't already, because I would love for you to come along on this NP journey with me. So yeah, the surgery was very interesting. We had a new patient come to the office. She was an ER follow-up referral, and she was going to be a new patient to the doctor that I'm with. And so that in and of itself is not intriguing. However, when she came in, she was in so much pain in her abdomen, her lower abdomen. It was excruciating. She couldn't hardly walk. She couldn't hardly talk. She couldn't hardly breathe through the pain. It was so intense. And her husband was trying to get the history for her. And so as it unfolds in the emergency room the day before, they did a pelvic ultrasound, and they ultrasound her ovaries, and they found that she had what is called a dermoid cyst. So on her left ovary, she had a dermoid cyst. And so of course, me being the novice that I am, I had to look up what is a dermoid cyst, and it was absolutely so crazy. So I would use the term, it was so bizarre, which is funny because google.com says that a dermoid cyst is a bizarre tumor that is typically, generally speaking, a benign tumor, but inside of the tumor, which is actually concealed in the ovary itself, you can have teeth, bone, thyroid, skin, and hair, and or hair and fluid. So obviously that was very intriguing, an amazing educational experience for me to be able to witness the removal of this dermoid cyst. And I'm so grateful for that experience. The surgery went phenomenal, little to no blood loss at all. She did well with the anesthesia. And, you know, it was really, really interesting. So they're going to obviously send that off to pathology and see what the report comes back as. And yeah, so we went out and updated the husband on how she did, and she's going to spend at least one night in the hospital, if not two, and then she'll be able to go on home. And it was a transverse incision in the lower abdomen, so just like a C-section, and she actually had 4 previous C-sections, so they didn't make the incision in the exact same location. And in addition to the surgery, they went ahead and did some adhesion or lysis of adhesions from old scar tissue from her cesareans. And I thought it was super amazing that the doctor that I'm with is a woman, and I thought that it was really just super amazing that she cared about what the woman's surgical scar was going to look like once it healed. So although that's more of a cosmetic type thing to think about as a woman, with body image being important even as a man, but as a woman with body image being so important, and self-esteem, and especially with a patient who previously has dealt with anxiety and depression and so on and so forth, I just thought that it was super commendable of the doctor to release those adhesions and make sure that that surgical incision was going to lay completely flat to the best of her ability. So they closed the incision up with a couple of sutures, and then they also did some removable staples. So yeah, it went really well. So this was an absolutely amazing day. Super excited for this opportunity. Go ahead and subscribe to the channel, grab that free printable below, become an NP with me. I'm just an average Jane who's doing her thing, and I would love for you to come along on the journey. Give this video a big thumbs up, and I will see you, my friend, in the next video.